Bank at FHB.com, IT&E, and Cabo Enterprises. Let's get Dr. Felix Cabrera in on the link Zoom room. Good morning, Doc.
Good morning.
Good morning.
Hope you're doing well.
Doing well today.
Okay, and
a little bit better.
I know you have something to share with the audience, so we'll just start there. A lot of people have been asking, where has Dr. Felix Cabrera been?
Well, I've been under the weather, so to speak, and so, I was pretty ill, basically for the past few weeks, and I started feeling symptoms that was mostly a cough and felt like a wheeze, and I don't have any underlying lung problems, and I went to get tested right away, ended up being negative initially, and felt kind of okay, took standard precautions, but then all of a sudden everybody else at Adelup was starting to turn positive, and so at that point I was already isolating, and the advice at that point was to be you're presumed positive at that point. And it was pretty rough what I went through. I do have some underlying comorbidities. I'm not ashamed to say that I'm actually an insulin-dependent diabetic, and so I have some underlying issues on top of that as well. So that puts me at risk. And at least to say is that the worst of my symptoms was the shortness of breath that I experienced, and it peaked about last week or so, and it was pretty bad. I was able to monitor my oxygen saturations at home. I was on the low 90s at some point. If I got up and walked, it was like around 89%, and normal, for somebody like you, me, and Sabrina, it should be definitely easily above 95% to 100%. So that was a bit concerning, but with the medications I was on, I started to see some improvement, did better. But there was a point where I was very close to going to the emergency room because the shortness of breath was starting to really take its toll with me. So right now I've been doing a lot better over the past week, and every day a little bit better. Especially yesterday was a really good day in terms of symptoms. I can actually talk now without going into a coughing fit, which is good, or feeling short of breath. I've been participating in the Zoom calls with the Physicians Advisory Group, with the governor each morning during our morning brief that we have every day, and so that's been good, and it's been good to get back into that role, and it looks like just in time, so to speak, to do that.
Did you participate? Well, first of all, it's good to see that you're doing better. Did you participate in the Physicians Advisory Group meeting yesterday?
Yes.
And if so, can you tell us what was discussed?
Yeah, so of course we discussed the new, the 105 cases that were reported. We have been tracking that the numbers were going to be significant. We were still seeing this upward trend anyway, and so we have to remember that there's that this was also. This 105 is a bolus as well of numbers, not from the widespread community testing, but it's a bolus that from results that came from DOD, and so putting that into perspective. And so if you tease them apart, not that you tease them apart in the community, they're a part of our community, but when you tease them apart in terms of how we've been tracking without those results, it's going up on both sides. So this is not just a DOD issue. This is not just a civilian issue. That this is truly a Guam issue, and that we have to approach this in a coordinated fashion.
Mm-hmm. What about the situation with our hospitals and the hospitalizations rate? I know in the SIT report, it's a different number from what's in the JIC report, because in the SIT report it says 17 hospitalizations. But in the JIC report, I think it's like 13 and or 12 or whatever. But where are we with hospitalizations, and what was discussed last night? I mean, what is the trigger point for us to make the ask to Joint Region Marianas for help?
Well, the ask has already been made.
Okay.
Is my understanding in terms of at the very minimum activating the help of personnel. So the thing that we have to understand with the hospital numbers is that even though if you go back to April, the peak hospitalization we had was about 25 patients. But you have to remember back then, we were very conservative with discharging. In other words, we were holding on to patients a little bit longer than we probably would have, because we weren't comfortable with how to treat this new disease. This is different now, with way more experience, and so a lot better understanding of who's more equipped and able to go home. So actually, the turnover time has been quicker. So the hospitalization stays have been a little bit shorter. So bottom line, what I'm saying is that the number of admissions have actually gone up significantly. It's just that they discharge and then they just admit more. And so that's why we're seeing that number. So we're not as bad in terms of the full amount as back in early April, but we're not, but it won't take long until that becomes an issue. The other thing that's really dire is that back in April, the non-COVIDs weren't as much of a stress on GMH in particular. GRMC was taking a lot of the non-COVIDs. Right now, in both hospitals, non-COVID census was very high. And then now you're adding on this additional COVID cases. This is exactly what we're trying to prevent. And that our system is so brittle that's why, people who became complacent, who were exhausted with all these recommendations of mitigation, who are skeptic of it, who just had, completely selfish and stubborn about it. This is what happens. This is the result, and this is exactly why we were very concerned. We were criticized a lot for maybe going too far, but we clearly did not go far enough, and there's something that we're not doing right as a community, and we never take credit as a whole, and we'll never take blame as a whole, and so that we're all in this together, and that we really have to unite. This virus preys on our cultural values. It feeds on human to human interaction and our need and our want to do that. So it's something that we really have to take a step back and understand that we have cultural values evolve, but our love for one another and our love for one another is something that will always be consistent. And so we just have to figure out a different way to show that love. And Chris, you're right. You said it earlier, is that the household contacts are not, as much of an issue. It's your family, it's your near family, your immediate family that you don't live in the same household with. And when you interact, because you miss them so much, I think that's where a lot of that risk happens. And then that's where you feel more complacent not wearing a mask because it's someone you know. And so it doesn't work that way, unfortunately.
For you, Doc, in terms of how you got COVID, was it through some sort of interaction that you're talking about, and you weren't wearing a mask?
Well, the thing with me right now is that I'm still considered a presumed case,
right?
And it's because of the scenario and the circumstances, and that because I was because I'm a high risk. A potential high-risk patient myself in terms of my existing comorbidities, that the decision to immediately isolate and to do what I can to protect myself and protect others was the case. So we know that a number of persons at Adelup have become positive, and I spend majority of my time in Adelup as well. And so that's something that is part of the connection there. And so it's in that case there's no clear index patient, and that we there's been a variety of in terms of the symptoms that people have gotten, of course have been variable, like the diseases itself, some completely asymptomatic and
right.
some much worse, including myself, and so it's hard to say what that was, but mainly I was just speaking in general, Sabrina, in terms of our interactions, because even I'm not perfect, I know that, and that I may not follow 100%, and it's very difficult to try that. But if we hold ourselves accountable, and we really keep trying to remind ourselves, then that's going to be a better pathway to get this.
Right. So
I wanted to follow up on the ask. You said that the ask was made to the military. So are we just talking about personnel, or are we talking about we're going to see these tents going up?
Yes. No. So the ask is me in several stages. So part of the ask, for example, is it starts with the Guam Guard, of course, and what are the specific requests also through Homeland Security and all that. So because I've been mostly working here at home, I haven't been in the nitty-gritty detail from the state surgeon's cell in terms of all that. So I won't comment, much on those details, but those wills have been moving even before this 105 cases. That those wills were definitely turning because we've been following this early, and so I wanted to make sure I clarify that.
Okay. The military, that was a huge increase in the military numbers. I believe it jumped by 52 positive cases. Are you aware, or can you give us any other information on where this increase is coming from? Are we talking about Anderson or Big Navy, or are we talking about
Guard?
active duty National Guard?
I don't have that specific information, but I can pretty much. It's a good guess that it's going to be a mix, and that you're going to see a mix, and that we have been getting positives from them, and they can contribute to the positive numbers throughout these past few weeks as well, right? Like all the other, and you can see them in the JIC reports. The key things that we have to understand is that this has been PCS season, or permanent change of station season in the summer, where we've been getting new, not just active duty, but of course their families, and they've been coming in from from stateside, and so the quarantine process was meant to try and contain some of this. I'm not saying that this were all not community spread. This is clearly there's a component of community spread here, but that's something that was clearly part of the risk that we understood and that we tried to mitigate the best that we can, and but this is still where we're at right now. When you think about the test positivity rate, just on this for the DoD side, I think it was like about 15 or 16% of that was positive compared to what was tested. Whereas you look at the rest of public health labs, it's around like 6% or so, something around those lines there. So still both bad. The 6% is still not too bad. We want to be below 5%. We're ideally below 3%.
Right.
Anything above 10% is considered uncontrolled.
Right. So
10% is the key part. So once we're there, it's bad.
Is there any particular?
Go ahead.
I wanted to know, is there any particular reason why we can't get a breakdown of how many Air Force, how many Navy? Because we do have civilians that work on base that might want to know, if they have been exposed or potential exposure.
Is it just Joint Region that's not being forthcoming with the info, or have we asked for a breakdown? Or?
No, I don't think it's about them not becoming forthcoming, because I know they do report the specific cases to public health by law, and so that part I'm sure is they're complying with, but I can't say specifically in terms of other reasons that I don't know if it's more about simplicity or what, because we're getting into that granular detail. I don't know the answer to that.
Okay, so we just need to ask public health, can you please be more specific?
Right.
What about quarantine? Are we getting rid of the home quarantine? Or this early testing out? What was discussed last night?
Well, it sounds like the governor, wants to ensure that we actually quarantine, right now during this full lockdown, the stay-at-home order, that the quarantine actually of incoming flights is going to be, I believe, in every flight coming in actually. I'm not sure the time period. I know that's going to be discussed much more in detail as well, especially at our 8:30 meeting with the governor. So that's going to be a big topic, I'm sure.
All right. Just for clarification, do you know if banks are closed or the construction industry are?
I got word from Crystal that the construction, and I think she, let me just read you what she said. No construction. If the work is on a base, we can't control that. But construction outside of the gate is paused for this next week.
Okay. And banks?
Wow.
Should say,
Yeah.
okay.
Doc, I mean, we'll go back to you and the COVID. So you didn't test positive, but pretty much you had COVID, right?
I had every pretty much sign and symptom that was consistent with COVID. The other thing that it could have been also is influenza, but it's one of those things that it just just didn't match up as well in terms of what the clinical characteristics of it. I'm not trying to be my own doctor here, and I did have other doctors and providers help provide my care, and so that's the case. So that's why it wasn't like something that we were just announcing, saying that Dr. Cabrera test positive for COVID, because technically I had not tested positive, and that it was a presumed case, and every precaution has been taken to be presumed. Eventually, I'll get a serology test to confirm or review what that is, and I pray to, at this point now, I pray to God it was positive and that I did have it, because I can't imagine going through something like that again, or that was just a flu. And by the way, the flu is very much present right now, and it is going around the community, and so that's something that we have to be very vigilant about. And so that's a second punch that we have to be really prepared for. That's why as soon as the influenza vaccines start becoming available here on island, that has to be a priority for everyone to ensure that you get that. Of course, there'll be a priority list, but everyone should get one.
Right. I mean, it's kind of hard to worry about a second punch when you're getting kicked in the teeth and punched in the back. And Doc, so what I find interesting is that from patient to patient, like you had said, we just see a wide range of different symptoms with the COVID, where we had, we've spoke to the governor. I mean, she was teleworking. But then in your case, was it your pre-existing condition of diabetes, you think that led to some of the respiratory issues? Because I remember I'd reached out to you to come on, and man, it broke my heart. You were telling me like you couldn't talk for more than a minute without breaking into a coughing fit.
Yeah, and it was the cough, and just shortness of breath by itself, even without the cough, was the really tough part. But yeah, it's right. But one thing that's for sure is that this is exactly why this virus is so dangerous, and so because when we can't figure out these certain things, and we have so many different presentations, that's what really makes it very difficult to control. So that's why this universal approach in terms of mitigation is really, really important. And to go to that, but then I've had certain surgeries as well, abdominal surgeries and things like that, and those are other reasons why I'm prone to complications. So there's a variety of different things, but young healthy people, Will Castro, of course, as you know, was tested positive. He's my brother-in-law. And his symptoms were quite severe, and he's young and healthy and robust, but he was knocked down by this pretty bad. Wow. And so,
Doc, I wanted to get back to the situation with the hospital. Do you have any information on the status of the opening of the COVID Care 4 unit to augment the COVID Care 2 unit which provides the critical care? Intensive, what is the ICU level of care? And also with the SIF, the SNU, we have been speaking with the hospital administrator, Leon Posadas, about these chiller units. And she said that hopefully by the end of this week, they might have one of those chiller units installed. And also, are we looking at opening up another isolation facility?
So right now, the main part here is that there's physical capacity between GMH and GRMC right now is okay in terms of being able to physically. It's what's really the strain right now is the staffing. Also, when staff are getting sick themselves and having to go out, and so that's been the biggest challenge right now. So opening up these like the Care for and those are one of the first focuses right now. Of course, we really need the SNU to be up and running as a place to decompress as well. So that's something that's really important. So right now the focus is more on staffing. There's going to be the complement to the staffing is that we kind of the same process that we did in planning from earlier from a few months ago is what we're kicking in right now. And that's the use of community nurses, for example, that are able to help with in the hospital, or nurse extenders like the medics in the National Guard.
So maybe even GDOE, because now that the campuses are kind of closed.
Correct. And so that's my understanding, is that there's direction for that, and that there's a push for them to have immediate orientation and to go into that process so that they can assist in however way. I hope myself once I'm out of isolation, that I'll be able to help myself directly in the clinical settings.
Yeah, but for like ICU, when we spoke to Lillian, that takes a special kind of nurse with special skills, right? And do we have those nurses on island?
Well, we definitely have the nurses. We don't have enough, and the ones that we do have are working extra hard, and so that's part of the things that's the challenging part. But that's one of the first asks as well that we have is to how do we get additional critical care trained nurses, because these are the ones that we're going to need the most. They're the most valuable persons on the island, or who could be coming to the island right now.
So is that where the military is going to come in?
It looks like, or we hope so.
Okay. I'm sorry, did you want to?
Doc, I just wanted to ask, so when we went under this current version of PCOR 1, it seemed, and I brought this up with the governor, it seemed laxer than the prior one, right? And so what we were seeing was just people were still out there, they were going around, and right away we heard from the doctors, public health, because of the numbers never they haven't gone down, they've gone up, right? So right off the bat, people were saying 2 weeks isn't long enough. So I just got to ask, I know we haven't even got into the deep lockdown at noon, but is a week reasonable? Is it reasonable to expect these numbers to become lower, to become manageable for our healthcare system to, emerge, I don't want to say unscathed, but to come out of this week-long lockdown in a better place?
And really, is 1 week long enough?
Yeah, that's so. I mean,
you have to really understand also is the lag, right? So the lag is real, and that in terms of when you look at the transmissions to when they were testing positives to when they end up in the hospital to even deaths, right? And so the actions and right now the numbers that we're seeing in this spike, this is probably activity that happened before the declaration of PCOR 1, and so we have to be very clear about that. And so we may all of a sudden see a quick drop off, and that because of the early actions of going into PCOR 1. So there's a significant delay that we have here that we see. So, and we have good evidence to see what that kind of delay is from the data that we have from March and April, and in terms of when mitigation efforts were taken, and then how long did it take for us to see a change, and then we also know what was effective as well. And so we tried to not go full on, PCOR 1, it was more like PCOR 1.5, but now it's definitely PCOR 1. And so because we know those truly did make a big difference back then. And I think the governor's acts and doing them early was critical, but we have yet to see that result.
Right.
I think that in 1 week from now, we're going to have a lot of information to see where things are going. The trend have been going up. What was interesting also is, and what concerned us, and this is even after PCOR 1 started, this PCOR 1, was that every time we saw a bump in new cases, you saw a subsequent bump in hospitalizations, then the flattens, and then we saw another little bit of a bump, and then a little bit of a delay. Now what we're seeing is almost a simultaneous rise in new cases and hospitalizations, and that's the scary part. And so that's the part that we realized 2 days ago, basically when we're looking at the data and how the trends were. And so then that's when, in fact, there was even before the 105 cases came out, where the discussion from yesterday morning's governor briefing was to actually implement some additional restrictions. But this changed everything once we saw the numbers, and it made it very easy to make that decision and to just completely go into a stay-at-home order.
Bree?
Do you have any other more?
Go ahead.
No, I was going to ask for people who are watching and they're at home and they're concerned about their health. What advice can you give them in terms of like staying healthy? Like
Thanks.
drink.
And this is one of the things I think is really, really important. And I know everyone's scared and everyone's afraid and more concerned about what they can do. But one of the easiest things you can do, and do it on a regular basis, aside from what we're always talking about, washing hands, wearing a mask, and social distancing, is eat healthy, get activity, exercise, lose weight. Losing weight is one of the main ways that you can, if you do get COVID, to help keep you out of the hospital, really. And so with that, we see that complications do rise in those who are obese or who are overweight. And so we have to do our best to do what we can to take care of ourselves. And everything about COVID has been lifestyle modifications, but we have to go to very basic lifestyle modifications, which means to eat healthy and get your exercise and lose weight.
But Doc, I mean, the beaches are closed, right? No going to the parks. No,
Yeah, parks and beaches, correct.
they are even for individual exercise. They're closed.
Yeah.
Okay.
Wow.
Put
wanted
on
to make sure that was
a
clear.
YouTube of light exercises, even if you can do that sitting down.
Right. I might do a Zumba live on my Instagram.
There you go. TikTok. Do a
TikTok.
TikTok.
Yeah.
Oh.
Nice.
Jason, we have a
Jason. That's
TikTok guy
Jason.
over here.
Yeah,
Doc,
Go ahead.
I wanted to ask, I mean, have you heard anything from Lieutenant Governor Josh Tenorio? Because I wanted to ask in the press conference yesterday, but we only got a couple questions. So, I mean, I know the HIP and everything, but, we're just concerned.
Yeah, same here. And but he was not in our past few morning briefings that he typically joins the governor with.
So, yeah, we're definitely some prayers for the Lieutenant Governor. Dr. Cabrera, in closing, I'm glad that you came on. I'm glad you shared your presumed COVID story, and I'm glad you're able to shed a lot of insight because, you're one of the point guys in the Physicians Advisory Group. So as people wake up this morning and they know that at noon we're going into a very strict lockdown, I just want to give you the floor and maybe a closing message for our audience.
We put out a public service announcement, a while ago about I protect you, you protect me, and that could not be any more important right now. In that we have to protect each other, and that means wearing a mask, washing your hands is not just about protecting yourself; it's about protecting the next thing you're gonna touch, and that somebody else might touch. And so and social distancing, of course, is very important, not just for you, but for the other person. And so protect each other, and that's my biggest plea for everyone. Please protect each other, and practice empathy with that.
All right. Thanks, Doc.
Wash your hands.
Wash
Stay
your
home.
hands, don't forget your thumb.
Don't forget your. Thank you for that one, Doc.
He's been saying that all the time.
Right. Okay, Doc. Be safe, huh? Get well.
Hey, good morning.
Okay, Dr. Felix Cabrera from the Physicians Advisory Group. Thank you so much for joining us. Doc, we are going to take a really quick break, and we continue with the White Coats this morning. On the link, it's The Breeze 93.9. Dr. Vince